Hi, my name is Anna. I'm a student nurse. Is it okay if I perform a quick abdominal assessment on you?
Yes.
Alright, I'm going to do my hand hygiene. I'm going to pull this curtain for your privacy. I just have a couple of questions to ask you about your past medical history. Do you have a history of gastric reflux?
No.
No. Any stomach ulcers?
No.
Liver disease?
No.
Have you been nauseous or vomiting recently?
No.
Any changes in your bowel movements?
No.
Any changes with your urination?
No.
Alright, great. Have you taken any medications for your stomach like Pepcid?
No.
Any Tums, antacids?
No.
Have you been on any IV fluids?
No.
And have you taken any laxatives?
No.
Alright, do you smoke?
No.
Any alcohol intake?
No.
Have you had any recent tattoos or piercings?
No.
Do you exercise?
Yes.
Alright. And what's your diet like?
It's pretty good. It's balanced.
Alright. Good to hear. Have you had any recent IV drugs?
No.
Alright. So I'm going to go ahead and start with your exam. I'm going to first start with inspection. So I'm going to actually get down at eye level with her abdomen, and I'm going to inspect the shape and the contour. Her abdomen is symmetrical and obviously flat. I'm going to look at the color of her abdomen, and her color is appropriate for race. I'm going to go ahead and look at if she's using any accessory muscles for her respirations, and she's not. I'm also going to look for visible peristalsis, which I don't see, and I will also go ahead and look for any pulsations, which I also don't see, but it would be normal to see a little bit of a abdominal aorta pulsation. I'm going to look at her musculature, so if you could go ahead and lift your head and shoulders off the bed. Perfect. So I see that she is strong and her muscles are intact. I'm going to inspect for any masses or nodules, which I do not see upon inspection. So next I'm going to listen to your stomach. We're going to auscultate before we palpate or percuss. So I'm just going to lift up your shirt just a little bit, and I'm going to start with listening to her bowel sounds, and I'm going to use my diaphragm for this. So I'm going to start in her right lower quadrant, and once I hear bowel sounds, I'll move up to the right upper quadrant and the left upper quadrant and the left lower quadrant. Okay, and her bowel sounds were normoactive. I'm going to go ahead and listen to her abdominal aorta, which is going to be right above the umbilicus. And I don't hear any bruits here. And then the last thing I'm going to auscultate is for venous hum, so I'm going to place that right over the umbilicus. And I do not hear a venous hum, so that is normal. I'm going to go ahead with percussion. So first, I'm just going to percuss around the abdomen. So I will go ahead like this. And I hear tympani, which is normal. And then the next thing I'm going to do is I'm going to percuss your liver span. So for this, I'm going to start in the right lower quadrant, and I'm going to percuss up to where I hear dullness. So I'm going to hear a tympani here. And right when I hear the dullness, I'm going to stop and mark at that point. And then I'm going to start at her right upper chest and percuss until I hear dullness, and I'm going to mark that spot. And so what I would do to measure her liver span is measure the length in between these two spots, and I would get about 6 centimeters for her. Next thing I'm going to do is I'm going to percuss the kidneys. So I'm actually going to have you stand up for this and face the wall. And I'm going to place my hand at her costovertebral angle, which is right about here, and I'm going to hit it with the fist. And I would ask her if she felt any pain. Did you feel any pain?
No.
Alrighty, and I'm going to do this on the other side at the costovertebral angle. I cannot say that word. And did you feel any pain?
No.
Alright, so that is good. You can go ahead and lay back down. If she did feel pain, this would indicate CVA tenderness. So we would be looking at something like pulmonephritis. So that's it for percussion. I'm going to start with palpation now, and I'm gonna start with light palpation, and I'm just gonna start with my fingertips and go in all 4 quadrants. And I will note that her abdomen is soft. Do you feel any tenderness?
No.
Okay, great. I'll proceed to do deep palpation after I do my light, and I'm going to be pushing down about 5 centimeters in all 4 quadrants, and I'm feeling for any bulges or abnormal like organ size. Do you feel any tenderness?
No.
Okay, good. Next thing I'm going to do is something called the shifting dullness test, and this is going to test for fluid in the abdomen, which is also known as ascites. So what I'm going to do, well, obviously she does not have fluid in her abdomen, but if she were to, I would start with right here, her umbilicus, and I would percuss up. And I would percuss until I hear dullness. And, when dullness changes to tympany. And then I would go ahead and ask her to turn onto her left side and face me. Perfect. And I would start at her umbilicus again, and I would start from the bottom of the mattress and move up. And I would note where dullness changes to tympany. And you can go ahead and lay back on your back. Thank you. And if she were to have fluid in her abdomen, those 2 lines that I marked from dullness to tympany would be different, but she has no fluid in her abdomen, so we don't need that. So next thing I'm going to do is test for rebound tenderness, and this is going to see if she has any inflammation in her abdomen. So how I'm going to do this is I'm going to palpate deeply into her abdomen right below the umbilicus, and I'm going to go at like a 90-degree angle. And so what I'm going to do is I'm going to press down, I'm going to quickly release, and I'm going to ask her if she felt any pain.
No.
And that is negative for abdominal inflammation. I would also be watching her reaction while I do this to see if she makes any painful faces or anything like that. The next thing I'm going to do is called the obturator test, and this is going to test for appendicitis. So what I'm going to do is I'm going to take her right leg, I'm going to pull it up right here, and I'm going to externally rotate it and internally rotate it, and I'm going to ask her if she felt any pain.
No.
Nope. All right, so that would be negative, and again, if she were to feel pain, that would be an indicator of appendicitis. So the next thing I'm going to do is the Murphy sign, and this is going to test for cholecystitis, which is also inflammation of the gallbladder. So I'm going to start here at her right costal margin, which is also where the liver would be. And I'm going to take my fingers and kind of hook them under the her ribs, and I'm going to ask her to take a deep breath. So ready? Inhale. I'm going to push my fingers under, and you can go ahead and exhale. Did you feel any pain?
No.
Okay, so if she did feel pain, that would be an indicator of cholecystitis. And the last thing I'm going to do is I'm going to measure her abdominal girth. So if you could go ahead and stand up for me. And let's see, I have my tape measure here. If you can face the camera, yep. I'm going to start at her umbilicus, and I would go ahead and take this all the way around her stomach, and I would measure what that reading is. And something important to remember is that I would measure in centimeters, and you're also should do this at the same time every day. And that concludes my abdominal assessment.